Okay, here's a question for you. Did you know AI could potentially free up enough physician time in just 1 year to equal almost 5 entire working years?
Yeah, it's a pretty staggering figure, isn't it? That's exactly the kind of potential we're trying to unpack today.
We're doing a deep dive into ambient AI scribes in healthcare, looking at how they've actually performed after a year out there in the real world.
And we're basing this on a specific piece of research.
Right, it's from NEJM Catalyst Innovations in Care Delivery, published March 31st, 2025. The title is Ambient Artificial Intelligence Scribes, Learnings After 1 year and Over 2.5 Million Uses.
A pretty comprehensive look covering a lot of ground.
Exactly. And our mission today is really to figure out, are these AI scribes sustainable? Are they genuinely effective at cutting down that documentation hassle for doctors and maybe improving the patient visit?
So let's start with the why. What was the big problem these AI tools were meant to fix?
Well, the core issue, and it's a massive one in healthcare, is the sheer burden of clinical documentation.
Oh, yeah. It's just overwhelming. It leads straight to clinician burnout, job dissatisfaction.
Then you have to imagine it potentially impacts the quality of care, too, if doctors are just swamped with paperwork.
Absolutely. This wasn't the very first attempt either. The article mentions this built on earlier pilot programs.
Okay, so the problem,
Mm-hmm.
too much documentation. The proposed solution, these ambient AI scribes, how do they actually work when implemented?
So the idea is they use generative AI. They listen with patient consent, obviously, that's crucial.
Right.
They listen to the doctor-patient conversation and automatically generate the clinical notes.
Okay. And how did the rollout go? Did doctors actually use them?
Yeah, what the study found was really interesting. Usage grew pretty steadily, quite linearly over the first year. This was within the permanent and medical group, a big healthcare system.
And was it everyone using it equally, or?
Not quite. It seems about a third of the users accounted for most of the use. A sort of power user group emerged.
Which suggests that for those who really adopted it, it was providing real value.
Huh. Exactly. That's the implication. They really leaned into it.
Did they figure out who these power users were? Like younger doctors, or maybe those closer to retirement?
That was one of the surprising bits, actually. They looked at standard things like age, how long since graduation,
Hmm.
and none of those really predicted adoption. It wasn't clearly one demographic group over another.
Huh. Interesting. So it appealed more broadly than maybe expected.
It seems so, and the
Mhm.
feedback from the physicians who did use it, overwhelmingly positive, according to the study.
That's great to hear for the doctors. But what about the other person in the room, the patient? How do they feel about this AI listening in?
That's obviously a critical question. The study reported that all patients involved felt the AI scribe had either a positive or a neutral impact on their visit quality.
Okay, so no negative impact reported by patients. That's really important.
Definitely. It suggests it wasn't perceived as some kind of, intrusive barrier between them and their doctor.
Now, something else happened during this first year, where they actually switched the company providing the AI scribe technology.
It did, yeah. A vendor transition midstream.
How did that affect things? Did usage drop off?
Well, that's another key finding. The transition seemed pretty seamless. Usage patterns stayed consistent, and the heavy users of the old system quickly adopted the new one.
So that suggests the value wasn't just tied to one specific product.
Exactly. It points to the underlying value of the technology itself, the automated documentation function. That seemed to be the core benefit doctors were latching onto.
Okay, let's talk impact. We started with that big number about time savings. Did the article quantify that more specifically?
It did. They estimated that over that first year, the physicians using the AI scribes saved, get this, over 15,700 hours on documentation compared to colleagues who didn't use the system.
Wow, 15,000 hours. How does that translate into, like, work days?
It works out to roughly 1,794 working days, almost 1,800 days of physician time freed up in 1 year, just within this group.
That is huge. That's time that could potentially go back into patient care or research or just maybe preventing burnout.
Precisely. It's a very tangible benefit.
So given these positive results, what did the researchers say should happen next? Where does this go from here?
Well, they noted there's still more to learn, like understanding the impact across different kinds of clinical settings, different specialties, maybe different patient demographics.
Makes sense.
And they also suggested looking into strategies to encourage the non-users. Why weren't they adopting it?
Hmm.
And also allowing for more individual customization of the notes, maybe, to make it even more useful.
Right, tailoring it a bit more. Okay, so summing it up, the big picture seems to be that these ambient AI scribes, at least in this large-scale study, show significant promise.
Yeah, real potential to ease that documentation burden, save doctors substantial time, and do it without negatively impacting the patient experience. In fact, maybe even improving it for some.
It sounds like a technology that's finding its footing and proving its worth.
Looks that way. Seems potentially sustainable, and could become even more effective with further refinement.
Now, if you found this discussion on AI's role in clinical documentation interesting, you might want to check out our previous deep dive.
Yes, we looked at AI from a different angle than how it's being woven into the education and training of healthcare professionals, sort of the learning side of the equation.
Exactly. It provides some good context for how the workforce is adapting to these tools.
Which kind of leads to a final thought, doesn't it? Something for you, the listener, to think about.
What's that?
Well, given these clear benefits we've discussed, especially for the doctors who really engage with these AI scribes, what do you think are the main barriers, maybe psychological, maybe practical, that are preventing even wider adoption of these tools across healthcare right now?
Hmm. That's a great question to chew on. What's holding it back despite the potential? Definitely
Yeah.
something worth considering.